I would like to introduce you to our research presentation. Caroline and I chose to research the recent spike in opioid use among adolescents. This is Sandra Diana speaking. Opioids are medications that relieve pain. They can also change the part of the brain that controls emotions and cause a person to feel very relaxed and euphoric. Repeated abuse of opioids can lead to addiction. Medications that fall within this class include hydrocodone, Oxycontin, morphine, codeine, Vicodin, Percocet. And these medications are often prescribed for a variety of painful conditions. For example, dental work and injury-related pain. Both Carolyn and I are interested in this topic. She works with adolescents in the school system and has even seen some of her own students die as a result of prescription drug overdose. I work at an outpatient agency that provides treatment for individuals with substance abuse disorders. While most of my clients are adults, I have had the privilege of working with some adolescents. When I do intake assessments with clients, I learn what age the substance use began, and it is often during the adolescent years. Throughout our research, we found that teens are at high risk for several reasons. Adolescents have some misconceptions about prescription painkillers. We found some trends in our research, and when parents discuss substance use and abuse with their teens, sometimes they fail to address the prescription painkiller and how it can be a gateway to more illicit drug use, such as heroin. When parents fail to acknowledge this, teens are believing that prescription drugs are safer and not addictive. Most teens admit that it's easier for them to access prescription drugs because they're readily available, oftentimes found in the family's medicine cabinet. So all of these factors combined might be contributing to the rise in adolescents experimenting with opioids and oftentimes becoming addicted. So basically, our research project is attempting to explain the recent spike in opioid use and abuse among adolescents, exploring if there are any themes, such as a specific culture or group that we're seeing the spike in, or if it's across the board. We also wanted to explore the background of the adolescents to see whether trauma is involved, if there's divorce or death in the family that's contributing to the drug use. We found a study in 2012, the National Survey on Drug Use and Health reported that 9.5% of children aged 12 to 17 years reported illicit drug use among the past month. And prescription pain relievers were among the most commonly used. So we're hoping to find some results within our study that reveal some of the common factors among adolescent opioid use, as well as the prevalence of use. So how much they're using and what ages. Our learning objectives include, we're hoping to discover the themes among the opioid use and abuse, and better understand the prevalence, how often this is occurring. Additionally, we're wanting to promote education and offer some counseling services and resources for adolescents and their parents to help combat this spike and see if the education is beneficial. Our research questions include: what are the common factors contributing to the rise in adolescent opioid use? And what can professionals do to educate and enhance outreach services to educate and prevent this continued rise.
All right, so I am going to pick up where Sandra left off, and I will be discussing the part of our presentation in which we outline our methodology, our procedure, what are some of the possible outcomes that we have anticipated, and then I also provided our final completed poster on the very last slide that I will be just sort of briefly outlining. So we determined that in order to answer our learning objectives, that the best screening tool would be the drug abuse screening test, or the DAST-20 in this case. There is a DAST-10 in which it is simply 10 questions. The DAST-20 is a 20-question screening tool with simple yes or no responses. So the DAST-20 was developed by Harvey Skinner, and we did modify this slightly because the original drug abuse screening test was to provide sort of a brief, simple, practical method for identifying individuals who are abusing psychoactive drugs. And so we decided to tailor this to be a little bit more specific to our learning objectives, and just sort of tweaked some of the wordage to more accurately describe opioid use specifically. And so we would be administering this to students aged 12 to 17. Now this test could be administered in a structured interview, but in this case it would be just sort of a self-report screening. And so we would be using the DAST-20 screening tool that accompanies this particular test. And as you can see at the bottom of this slide is a pretty brief summary of what these scores indicate for this test. So for each question that is answered yes, a participant would receive 1 point, and the only exception to that is questions 4 and 5, in which an answer of no would also receive 1 point. So the scores obviously range from 0 to 20. 0 indicating, no severity, no substance abuse or misuse, and no intervention recommended, all the way up to a score of 16 to 20, in which the participant would be labeled as a severe misuse, and some sort of intensive intervention would be recommended. So here we have the 20 questions in our screening interview, and the questions refer to the previous 12 months, but we also decided to couple this with a just brief demographic survey, since we do want to see if we can identify any themes associated with adolescents and their opioid abuse. And so we did ask them their age, gender, and ethnicity, and see if maybe we can pinpoint an age in which this all begins, any gender differences or cultural ethnicity differences. And so our questions refer to, what sort of degree of problems do the participants have that are related to drug use and misuse. And they include things such as using or abusing drugs other than for a medical reason, using more than one drug at a time, or being unable to get through a week without them, not being able to stop, or possibly feeling bad or guilty about their use, losing friends or family members, or at least causing some strain on your relationships because of your drug use, possibly getting into fights or some other illegal activities, maybe an arrest has occurred, if the participant has experienced withdrawal symptoms, if they've ever received treatment in the past. So all of these are meant to give us an idea of at what age and what gender and what sort of ethnicity are we seeing some of these problems related to opioid use and misuse, maybe beginning or continuing. So in a self-report structured type survey, we understand that there are some possible outcomes that could give us sort of a misinterpretation of the numerical score. And one of those would be participants either underreporting or not being honest. And that's sort of the main reason we decided to make this anonymous and really encourage honesty among the participants because their names would not be collected. And the reason for this was that I sort of just briefly surveyed my own students and just asked them, if they were given a survey in which they were asked questions about their substance use, how honest would they be if their names were collected? And, unanimously, they all responded that they would most likely lie. To avoid any legal troubles or to avoid getting in trouble or to avoid being placed into some group or program based on the responses they give. So we decided to keep this anonymous and encourage honesty to avoid any underreporting or lying. And then we decided to provide participants and their parents or guardians with a number that they may call in order to receive services if they felt they needed it. And so all of these things can definitely lead to an incomplete picture of client because they are very simple, straightforward, brief, yes or no questions, and we know that most individuals, especially if they are misusing any type of substance, are very much more complex than what this survey might indicate. And so here's our proposal poster, and Sandra had kind of already gone over our summary and sort of our learning outcomes and what some of our questions we were hoping to answer. I discussed the methodology and possible outcomes with you. We also have our procedure listed here in which we decided to team up with local school district student assistant programs, or SAPs, and just sort of a brief history on student assistant programs if you are unfamiliar. Most school districts have implemented in recent years student assistant programs, and the team members usually consist of a regular ed teacher, possibly some administrators, guidance counselors, and school psychologists. And their goal is to ultimately identify students who are at risk and provide them with the assistance they need to sort of get them back on track. And at-risk students is pretty broad. It could just be students who we've maybe seen some behavioral changes, maybe social changes. Maybe they were once very social and now they're very isolated. Maybe they used to never miss school, now they do miss a lot of school. Or possibly a teacher, just through casual conversation or anything, has been alerted to something outside of school. Possibly a divorce in the family, abuse in the home, neglect in the home, maybe there's been a death in the family, so there's a number of things that could put a student at risk, and then the team would just assess that particular student in order to determine what services they may need, just to avoid any further trouble, possibly get them back on track, get them more stable. And so the student assistant program in this case would be administering our consent form that we would distribute to parents or guardians of our participating students, since they are going to be minors. Once we get consent, the surveys would be administered to the participants. The self-report data collected, as I mentioned, would be assessed using the drug abuse screening test screening tool. And then, as we also mentioned, we would be providing all participants and their parents or guardians with a number that they may call if they believe that they are at need for some additional professional services. And so this is also hopefully to promote some educational services for our parents or guardians along with adolescents and so that we can, enhance some outreach services for our participants and this particular age group, as well as their parents or guardians.